anything pregnancy related, childbirth related, give her a buzz. 08085 92 95 00. We've got loads of questions in for you, Cass.
Great.
Has anyone ever fallen asleep while they're giving birth?
Occasionally, if somebody's had an epidural, they can doze off in between, and if they've had some opiate analgesia, pethidine, morphine, anything like that, then people can be quite drowsy. And it's normal, even without those things, for women to be a bit more drowsy towards the end of labour.
Wouldn't it be blissful if you slept through labour the whole way, and then somebody woke you up and said, "Wee, go at the end"?
I think you'd miss the best bit.
That's all right from where you're standing. Let's start off with some text questions, because I say we've got loads of them coming in. Emma would like to know, does long-term use of the pill reduce fertility rates? I don't know, is that outside your remit?
Well, I actually have some additional training in reproductive sexual health. So
she's good, this girl. We don't just get in anyone.
I know, I'm not just a pretty face, I know. Generally, there's no evidence that it does reduce fertility, but we do know that people that have used the pill for a long time, when they come off, it can take a while for their cycles to return to normal if they were planning on getting pregnant after that. But it can take a while.
Right, so it can have some impact.
Yes, just while your body adjusts and regulates and your own hormones kick in and go back to your more natural cycle, because a cycle on the pill is not a natural cycle. It's a man-made, manipulated one, if you like, through the use of the medication.
Right, okay. This one here, could you please ask Cass what the recommendations are for when to bath a new baby? We have a new baby in the family and the mother has yet to bath her, and she's 2 weeks old.
Increasingly, we actually changed practice. It used to be that, babies were born and within an hour they were plonked into a bath and dressed, and now that's not recommended. Babies are born with an oily, protective, natural moisturiser called Vernix on them. It looks white and is sticky, and this actually prevents the skin from drying out. It protects the baby from infections as well. So we don't actually recommend babies are bathed immediately anymore. Also, babies aren't born dirty. They are not they're not born unless they fall into a puddle after they're born. But generally, they are not born dirty. However, if there is any obvious body fluids or substances on them, it's worth getting a clean sponge, warm sponge, and washing it off. But there's no rush to actually put the baby into bath, because if the baby's relatively clean, there's no huge rush to do it. So,
I mean, is there a point at which, for whatever reason, you should do it? Should the baby have had a bath by such and such a stage? Or
not particularly.
No.
As long as the baby is clean, there's no, urine or feces or anything left. If it's had a really hideous nappy and it's gone right up its back.
Oh, I remember those.
We've all been there.
I've got Polaroids of those.
Yeah, maybe it's time. However, it's more about keeping the baby clean rather than putting it into a bath. And you can do that quite effectively with a wet, warm sponge or a flannel. That's quite acceptable.
I think a lot of it is the routine, isn't it? And people often talk about the bed and bath routine and the importance of getting a routine. So it's easy to see why you would think that. I mean, my youngest just hated the bath. I mean, just screaming habdabs, just absolutely hated it. And we always got to have a bath, until one day a light bulb went on and said, well, she doesn't really have to have a bath. But it's kind of somehow it's in your head that it's an essential thing. So it's good to hear not necessarily. On that, I mean, you're saying about babies not being born dirty, and we spoke earlier briefly about water births. There's a story in the news recently about a newborn baby that apparently developed an infection after it was delivered in a hot tub. Healthy baby, born full term, but was later hospitalised with a high fever, vomiting and poor appetite, and I think it was tied to the the hot tub. I mean, what are the protocols around water births, and is there any different risk attached?
I think this is a very sad story, of course. And the thing to differentiate here is that the baby was born in a hot tub, which is not recommended. So birth pools don't have water jets. Birth pools use clean water is not used water that's been sitting. The problem is in hot tubs, which we know even out with any consideration about giving birth, can harbour Legionella and lead to Legionnaire's disease, which is what happened to this baby. The baby, they shouldn't have been in a hot tub if they wanted a water birth. Using clean water that's been freshly filled into the pool on that day is important. But it's also important not to add anything to birth pools. You know, sometimes some people will get an idea that they want to add various oils or liquids or whatever it is they feel is going to help in some way. But it's important to remember that the baby is born into this water and is exposed to everything, including in its mouth and in its eyes and nose and ears. And so it's in this case, the baby was born in a hot tub. It wasn't born in a birth pool. That's a different thing.
Well, what is the thinking behind a water birth?
Well, everybody seems to, have the opinion that water births are actually quite a modern thing, and they're not. For thousands of years, right, as far back as we know, water has played some part in the labour and birth of a lot of communities around the world. It's not unusual for women to want to be in warm water. We know that women tend to relax more. It reduces the chances of complications. It makes them contractions more effective if it's used at the right stage. Sometimes people having a water birth, there is an issue about using the pool very early can slow the contractions right down. And obviously, if you're in labour, you want the contractions to continue so that you eventually give birth, and it's done. So,
does the baby like it?
It doesn't actually make a huge amount of difference to the baby in itself, other than the mother is in a better position. She's not lying on her back or sitting on her sacrum, which decreases the amount of space in the pelvis. So it's less likely to become distressed. If the mother is stressed, the baby is likely to become more stressed too. So if she's more relaxed, you could argue then the baby is less stressed and more relaxed too.
Right, okay. We've got loads of questions coming in, as I say, 80295. But do remember, pick up the phone and give Cass a call. Anything pregnancy and birthing related, 08085 92 95 00 is the number to call. Texting saying, I read something online that suggests a really itchy belly could suggest something quite serious. What's the chat on that?
This is true. Although itching of the belly in pregnancy is fairly common.
Loved it.
As you're, yeah, I know that feeling, really scratching your belly. But I think there is a differentiation between mild itching on your belly as you're caused by hormones rising, skin stretching, an increase of blood supply to your skin can make it itch more. But there are a couple of other conditions that it could be associated with. So the one everybody worries about is something called cholestasis, or ICP. And that is a much more serious condition that is linked to liver disease and really needs quite careful monitoring and the input of specialist obstetricians. It has much more severe symptoms though. So the itching is predominantly on the hands and feet, the palms of the hand, and is really severe. I mean, itching till skin bleeds severe.
Right.
If you have generalised itching, it's important to actually go and see your midwife or see your GP just to rule out that it's not that. If it's just on your belly and it's a bit itchy sometimes, I wouldn't worry too much. But if it actually starts to spread and your hands and feet in particular are itchy, then that's possibly more serious. There is another condition called PUP, which I won't even try to tell you what that stands for, which basically when the itching spreads down your arms and legs, and again that's due to hormones. It's very uncomfortable, but it's not quite as serious as cholestasis.
Right, okay. Another text in, will my baby start feeding as soon as I give birth?
Ideally, yes. Sometime definitely within the first hour. But in the few minutes following birth, usually mum's catching her breath, baby starting to breathe, and there's that little gap. But, a lot of babies very quickly, within 10, 15 minutes, are rooting around looking for the boob and, making all of the right attempts to feed, because not only has the baby used up a lot of energy in trying to be born, because it's hard work for the baby too, it also helps the mother's body decrease blood loss and deliver the placenta.
Right, okay. Another story from the news agenda that I think I actually mentioned earlier on. Can you get pregnant while you are pregnant? It happens, yeah?
Yeah, it's very rare in humans, but it can happen. And basically what happens is either the woman has two uteruses, two wombs, that she wasn't aware of, and each one has got a fertilised egg in it. But that's, more unusual. It's not unusual, though, for women to produce more than one egg in one cycle. That's how you get non-identical twins. However, to already be pregnant and then get pregnant again is quite rare, but it can happen. And there are some other risks associated with that.
Have you ever seen it?
I've never seen it.
No.
Never.
I mean, certainly people getting pregnant very, very quickly after the birth of a first child. But no, I had no idea that you could actually be double pregnant. Superfetation, that's the word, my goodness. Right, it's 11:20, we shouldn't keep you much longer, but one more quick question from Les. What are the pros and cons of epidural? Any other kind of pain relief during labour? I bet you get this question a lot.
Yes, actually. Having an epidural is really a very personal choice, and people have them for all sorts of reasons. The advantages are it's a very effective form of pain relief. It allows the mother to rest and relax, and it can lower the blood pressure if blood pressure is a problem. The cons are, of course, is a lack of mobility. So women, aren't as mobile, and we know that being upright and mobile actually helps decrease the length of labour, decrease the chance of sections, decreases fetal heart rate abnormalities. There is a small risk of having something, an epidural tap, which results in a really severe headache for a few days where the mother literally can't sit up. And also it makes labour longer. So it's really the individual has to balance in their own circumstances. Is this a good idea or not for me? You don't need an epidural any more than you need any other kind of pain relief, but you may well want it, and that's a good enough reason to have it.
And what are the alternatives?
There are a number of other things. Well, using water is one. You can have opiates, pethidine, another type of opiate, fentanyl. So it used to be morphine. Or you can, your own natural endorphins take about an hour and 30 minutes to reach a peak. And we know they're actually equivalent to a dose of pethidine in terms of pain relief. So sometimes having the right type of care, not feeling afraid, being in a warm, comfortable and preferably darkish environment helps your own natural painkillers kick in.
It can also, I don't know whether this was just kind of voguish when I was at that stage, it was called a TENS machine.
Yes. Yeah.
Which I don't fully understand what it was, but I remember being introduced to one.
People still use them. I remember trying them when I had my elder son, and he's 25, and thinking it was actually the distraction of this thing.
Gives you a wee buzz
buttons on it that seemed to help. But, some people do feel that they do work, and they certainly are used in other forms of pain relief for joint pain or lower back pain, or even for period pain. So it's not unreasonable to assume They're not quite as popular now as they used to be. You don't see as many women with them, and most maternity units have moved on to other options.
It's a very nice way of telling me how old I am, but that's fine.
I think we're the same age. So,
I think so.
We're both just youngsters.
Absolutely. Cass, thank you very much indeed.
You're welcome.
Really enjoyed having you here, Cass McNamara. So I hope you'll come back again soon.
Yes.
So that we can call the midwife again. People